Now, meantime, there's reporting from the Toronto Star that says the province of Ontario ignored advice from its own public health agency before releasing its new color-coded pandemic framework. And this is drawing some criticism from health experts. I want to bring in Dr. Michael Warner. He's the medical director of critical care at Michael Garron Hospital in Toronto. Good morning, doctor. Glad you could be with us.
Thanks for having me.
Okay, so what's your position right now with this, first of all, high case count, the fact that we're going to get more modeling today, and now we're hearing that the province of Ontario likely didn't take into account what everyone was saying before they implemented this new policy?
Well, I think like many Ontarians who have read the Toronto Star article, I'm shocked and disappointed. Many of us suspected this to be true, but to read it in the newspaper is very upsetting. Premier Ford has always said that health and safety is his number one priority. And there are many people who sit at many tables in the province whose goal is to provide the Premier and Cabinet with advice to protect the health and safety of Ontarians. And based on what I've read, and based on the heroic whistleblowing by Dr. Deeks and Dr. Sander, the best advice to keep Ontarians safe was not listened to. And the framework that's been created to help reopen the economy has not been adequately informed by science. And unfortunately, we're all going to pay the price for that.
Okay, what are your concerns then right now, doctor?
Well, we're on a horrifyingly bad trajectory right now. The modeling data today may show that we're on the road to 2,000 cases per day in Ontario. This morning, the data from Ontario ICU shows that there are 106 patients in ICUs in Ontario with COVID and 15 new patients overnight. We have outbreaks in long-term care homes. We have never reached the 50,000 tests per day threshold. Contact tracing isn't happening in our biggest jurisdictions. Where things are completely out of control and there's a complete absence of leadership at the microphone. We need someone to lead us through this with health and safety as the number one priority, because that's the only way the economy can reopen in a safe and sustainable way. 2,000 cases per day is horrible for business. Until we get those numbers down, people will not feel safe patronizing restaurants, stores, going to the bar, going to the casino, sometimes even going to school. So we need to get things under control quickly.
So what would you like to see happen? Are you in favor of a full shutdown, that we go back to March and April?
Well, the first thing I'm in favor of is complete transparency, the honest truth from Premier Ford. At his press conference, I don't want to hear about investments in tangential projects. I want to hear about who's actually providing him with advice. He needs to be straight with us and to understand why the framework that was created allows for the red zone to be at levels 4 times higher than what Dr. Deeks recommended with respect to percent positivity in incidence, and why the green zone, which much of the province is in, that's the least restrictive, is the rates are 2 times higher than was recommended, because that's a recipe for disaster. I think the framework needs to be scrapped. I think we need to start over, and we need to have it led by scientists. The economic recovery will follow if COVID gets under control. So we need an acknowledgement that things were not done properly, and we need a commitment that there's going to be new leadership at the microphone to lead us through the pandemic. That can't be Premier Ford or Minister Elliott or Dr. David Williams. It has to be someone else, a transformative leader who's not beholden to the government and who will make decisions based on science and solely science.
Okay, and finally, doctor, what are you watching for today at that 3 o'clock news conference where we get the projections for the next couple of weeks?
I have a pretty good idea of what they're going to show, and I think a lot of Ontarians do as well. The situation will not improve if we make it easier for people to interact. The situation will only get worse, and people will see that their Christmas plans will disappear and that it'll be a long, dark winter unless we get things under control. And that may mean some short-term pain for long-term gain. That may mean some form of lockdown in hot zone regions that is long enough to allow public health to catch up with contact tracing for us to get our testing infrastructure ready to go. Because without those counterbalancing investments, future lockdowns will be required even after the next one.
Doctor, we're out of time. Thank you so much for being with us this morning. Dr. Michael Warren, he's with Michael Garron Hospital.